At this time, Deputy City Manager Marlon Brown will do the roll call of city staff.
Thank you, Madam Mayor, and thank you, Commissioners. I will go through each department, and if you can just identify which department director is on the call, and please, as the Mayor alluded to, please mute your phones, department directors, when you finish with the announcement of your name. City Manager's Office.
John's here.
Barwin is here. And so am I, Marlon.
Thank you.
I'm Barwin.
Crystal Fraser is here.
All right, hold on, Crystal. I'll call each division. Economic Development in the City Manager's Office.
Steve Stansel is here.
Thank you. Facilities.
Rob Shanley is here.
Thank you. Grants Management.
Laura Wittenbauer is here.
Thank you. Homelessness Response.
Crystal Fraser here.
Thank you, Crystal. Public Information.
Dan Thornburg is here.
Sustainability.
Hey everyone, Stevie Freeman Montez here.
Thank you. City Auditor and Clerk's Office. Obviously,
Shayla Griggs here.
City Attorney's Office.
Present. City Attorney's here.
Thank you, Mr. Fournier. Development Services. All right. Financial Administration.
Judith Miles is here.
Kelly Strickland is here.
Human Resources.
Stacy Mason is here.
Information Technology.
Emilio Rodriguez is on.
Thank you. Planning Department.
Steve Cova is here.
Thank you. Office of Housing and Community Development.
Cindy Shaw.
Parking.
Mark Lyons present.
Thank you. Parks and Recreation.
Jerry Bogle.
Public Works.
Doug Jeffcoat and Alex Davishaw.
Police.
Chief Bernadette DePino and Emergency Management Director Todd Kirkering are here.
Thank you. Utilities.
Bill Reeby here.
Van Wezel.
Mary Bensel here.
Thank you, Madam Mayor. That's it.
Thank you. Next, I'm going to explain the procedure. It is essential that we all speak one at a time. So I will call on commissioners and others in their order of the roll call above when necessary. And I will call on staff as needed per the discussion. If either the city commissioners, charter officials, or staff would like to comment or ask a question, text me during this meeting. My number is, as you all should have it, but I'm going to read it again, 941-914-7646. Please do not ask me your question or state your comment. Just type in either the letter C for comment or Q for question. I have my phone right here, so I will be able to see who would like to speak when during our discussion. And at the appropriate time, I will call on any person who wants to speak or make a comment. If a question has not been answered or could not be answered, I will ask that it be noted by Mr. Barwin or Mr. Brown for follow-up conversation. There will be no public input taken from this workshop, as well as no vote taken by commissioners. And at this time, I would like to ask for a moment of silence for those who have passed and are ill due to the COVID-19 virus. Our thoughts are with their families and friends. And on a personal note, Tim Calendra was one of those who passed because of complications from COVID-19. He worked in and was a big supporter of our community arts and music scene, and he was a friend. So for the next minute, I would like to ask for a moment of silence, please. Thank you. The first item on our agenda is discussion of the COVID-19 virus, and I would just like to make some introductory remarks. Again, I'd like to thank you all for being here. I did want to remind everyone that the last time we met was on March 16th, 2020, which was 3 days after the city issued a declaration of public health emergency. I know we are still deeply in the midst of this pandemic. We have many more challenging days ahead and more difficult decisions to make. However, I would like to remind everyone of the capacity and value of our city's swift action on Friday, March 13th, 2020, and thank again the management and staff for working quickly toward that declaration, which was one of the first in the state. I acknowledge it was and is a hardship. And while it might have seemed at the time to some as overreaching, in fact, looking back at all the events and gatherings that were planned for that evening and that weekend and that week, I think we can all agree that one act saved countless lives and contributed to the slowing of the spread of the virus. Of course, we will never be able to quantify it, but knowing what we know now and how easily the virus spreads and how dangerous it is, I have to say thank you again to the city management and also to the organizations and groups who self-canceled upon the city's strong urging from the city's declaration. Since then, much of our businesses and our lives as we know it have been significantly altered. The governor finally issued a safer at home and essential businesses order on April 1st, 2020, and has issued other orders since then that impact our community pertaining to evictions and foreclosures and other items. The federal government issued the CARES Act, and we as a city are still working through the benefits and implications of that as well. I often receive questions from constituents about how the city functions in this emergency, and I thought it would be of value to explain that when the city issued a declaration of public health emergency on March 13, 2020, this action delegated the city manager, Tom Barwin, as our coordinator and central point of contact for the city of Sarasota during this emergency, as he is a professional city manager and has authority of our city staff. Our city's charter does not allow city commissioners, including the mayor, to direct staff without permission from the city manager. So this was the most efficient decision to manage this crisis. The city manager is in constant consultation with the city attorney, the police chief, the managers and staff, all emergency operations organizations, including the county and state health department, myself, and he has daily individual communications with each commissioner. This is a pandemic, this is a crisis, but I want to assure the citizens that the city and the city manager, Tom Barwin, and the city's management and staff, and your city commissioners are working around the clock to make sure we are doing everything in our power to protect the health, safety, and welfare of our community. And we will endure. We will get past this. We will learn from this, and we will have protocols in place, which we are already doing. We are a caring, strong, and robust community, and I am heartened each day with stories of kindness, empathy, strength, and generosity. We have weathered hurricanes, the economic challenges of 2008, and recently a devastating red tide season. We have bounced back every time, and we will do it again together. And I know you have all heard this, but it bears repeating. Stay home unless it is absolutely necessary, and stay safe. And with that, I would like to ask the city manager to please give us an update on the COVID-19 crisis.
Thank you, Mayor. Can you hear me all right in the council, in the commission chambers?
I can hear you just fine.
Okay. Thank you for that overview. Let's jump right into the COVID situation now. We have 151 cases that have been confirmed in Sarasota County since the outset of the pandemic, and the first case that was confirmed here. Of the 151 cases, 13 cases were non-county residents. That means they live elsewhere, either another state or another county, yet they were confirmed within our county. The County Emergency Operations Center is now putting out a daily flash report, and they have been now for about 3 weeks. And that gets into quite a few details, including beginning this weekend. The flash report includes a map of cases by zip code, which is very interesting. And I think what it tells us is that COVID is in place throughout the entire county east of I-75. The greatest number of cases, and especially on a per capita basis, are in the 34236 area code, and then similar per capita numbers are on Longboat Key and Siesta Key. So although COVID is throughout the county, these are the single highest concentrations that we're looking at. Any resident who wants to look at the details can go to our website at sarasotafl.gov and work their way down to the COVID-19 resources button and link. And then if you go to flash reports, you can begin to see the new maps of where cases are being reported by zip code. But with that said, and that's been pretty well communicated through the local media, certainly in an exceptional way through our social media and our website. My day is highlighted every day with a 2 p.m. conference call with our Emergency Operations Center, where all of the municipalities, fire and police and health agencies are all connected on a conference call, and we discuss the various situations. We talk about the status of personal protection equipment. We're talking about the status of emergency beds in our hospitals and the contingency planning that's underway to prepare for any scenario. We do have N95 masks within our city inventory, and we're equipping, of course, all of our public safety officers with that equipment, and many of our outfacing employees with that equipment. As you all know, most of what the city does falls under the category of essential services, which makes up about personnel make up 75% of our budget. So most of our people are still working. Our police officers, our utilities, our sanitation, our public works, our landscaping people, all remain on duty. Construction continues in the community, so we have many folks from NDS working. Your administrative assistants are still working. Calls are coming in to Diane and Kathy. They've been programmed to their homes. There was very intense activity and questions from the public coming in. It's tapered off a little bit as the media and our websites are answering many of the questions, especially after the governor's order. And the attention of the public now seems to be turning to unemployment assistance and business assistance. And on that note, our website is actually another great source for referrals. We do have a link for business assistance on that city website when you go down to COVID resources. And we also have a link to community service assistance. Those are just the big overarching, I think, summaries. Mayor, maybe I'll stop at this point for a minute for any dialogue on the specific COVID-19 situation in our city, region, and county. And I would just also note I've been on the phone regularly with my colleagues in Bradenton, Manatee County, Longboat Key, Venice, and Sarasota County in terms of what they're looking at as well.
Thank you very much. I just want to make a note to those of you who are listening. When you text me the Q or the C for the question or the comment, I may not have your number in my phone, so if you could just state your name as well, that would be helpful, so I don't have to announce your phone number over at the City Commission meeting. And at this point, then, I will call on the commissioners for questions. Commissioner Alpert, do you have any questions of the city manager?
I do not.
Commissioner Brody, any questions?
I don't have any questions based on what was just reported. I just have a couple topics, I guess, to bring up.
Okay. Okay, we can do
I'd
that.
like to hear from. I mean, if you want, do you want to do that now?
No, let's do that in a minute. I just wanted to limit it to what was just, we just spoke about from the city manager. And do you have any questions for him specifically regarding any of those items that he just mentioned? And we'll go through each topic one by one, and I'll call on all of you all to see if you have any questions.
No.
Okay. Commissioner Shaw?
Yes, ma'am. For the city manager, am I being heard?
Yes, you are.
Yes, you are.
Very good. Mr. Manager, I'm in concern with the 151 positives that we have had numbers. What's the total number that we have done? Where they're being done, and where and what are we doing in the case of equity? For this, I'm stating that within my district, much of the hospitality workforce and a lot of the healthcare workforce, and I have been back and forth with a number of these individuals during this time with none of them having been tested. I'm asking who's being tested, where the testing is taking place, and what do we do? How do I answer that question?
Very important questions, Commissioner. Most of the testing in our area has been done at Sarasota Memorial Hospital. About a week ago, the county opened up drive-through testing, which has to be done through a scheduled appointment, which emanates from a person's physician or clinic. It's then referred to the county health department, and the county health department then calls the people who are to be tested and schedules an appointment. The good news is tests are now coming back test results in about 48 hours, and they're communicated shortly thereafter by the health department to the individual. This is much better than 10 days ago when test results were literally taking a week to get back. There is some hinting that we may be receiving some of the rapid testing equipment that you've been hearing about in the national media. I have a question pending at the health department. I have the impression that when we get probably a limited amount of those tests, that those will be utilized for public safety, so we can ascertain quickly if they can continue to work or they have to be isolated and quarantined for the 2-week period so they don't risk contaminating anyone since you're so highly involved with the public. And Commissioner, I've also suggested and believe that rapid testing will also be available, hopefully, to hospital personnel throughout the hospital, including those that are doing the housekeeping and then the cleanup work and the custodial work in the hospital, since they're dealing with so much of the PDEs. For those who are uninsured, the best recommendation I have at this point is to call the health clinic and find out where they can go to get that referral. And we'll publicize that number. I don't have it right in front of me right now. Does that help at all?
Commissioner Shaw?
If I may. Thank you. I'm yet concerned, sir, because in the 37, I'm looking at my zip codes that you're giving me, and the 37 has a an abundance of the Hispanic community, many who have different issues, who may have been contracted the virus, but are unable to come out because of documentation or other immigration issues. How and what are we going to get to that portion of the community that is very, very much a part of the whole? Am I clear on that?
Yeah, I think you're clear. We have not discussed that at the EOC meeting, but I have heard some conversation at the federal level and the state level where the government is urging people to do what they need to do to take care of their medical situation. If they're feeling threatened and sick and difficulty breathing and have a high fever or a fever, I would suggest they need to do what they need to do to take care of their health and their lives. And at the federal level, I thought I saw or heard that they weren't monitoring the situation because of the crisis that it is. Try to catch people to deport them. I certainly hope that's the case. I guess this will have to pivot on an individual's confidence that is true, but I would certainly encourage everyone to do what they need to do to take care of their health.
Madam Mayor?
Yes.
Okay,
Yes.
and I'll be through. To the manager, to whomever, how do we get this conversation to this portion of the community? How are we going to get, and I'm only concerned about the local, I could care less about the state or the federal. At the local level, how do we get that conversation to the individual of this area? Because we're not doing it, the press is not doing it, radio is not doing it, and TV is not doing it. I just need to be able to answer my constituency.
Well, we will ask that specific question, sir, on our next EOC call. I will certainly consult with the city attorney. I do know under United States and Florida HIPAA laws, individual privacy has to be protected, so I would hope that would be especially honored during this crisis, which I would hope would protect individuals in the Hispanic community or people who are here without the proper documentation. But we will certainly ask that. I can tell you, and I thank the commissioners for doing the public service announcements, over 50,000 have looked at those public service announcements on our social media platforms, and we did get some feedback, Commissioner Shaw, that we have to begin communicating with the Hispanic community, and I know Miles is looking at that, and Jan and Jason, to try to make sure our communications moving forward are bilingual.
Thank you.
Thank you. Vice Mayor Freelandetti, do you have any questions for the city manager at this time on the topics he spoke of?
No, not at this time.
Thank you. Thank you. All right, at this time, I would like to then ask, I'm sorry, my phone keeps falling. I would like to ask each department head to give us an update, and Mr. Brown, you can do the roll call on that, to give us an update on what their department is doing and any information that they need to share. And then after we go through the whole roll call, I will open it up again to commissioners for questions. And just ask me, make sure it's clear in the question which department you are addressing your question to.
Thank you, Madam Mayor. Let me again remind the department directors that, again, if they have any responses to what the manager just mentioned and or updates, keep it as brief and as simple as possible. If you don't have any comments, please say none so we can move along to the next department. I will start with the City Auditor and Clerk's Office.
All right, I will have a couple of things. Just wanted to let you all know that We are scheduling meetings with the commissioners and city staff if you all decide to move forward with the April 20th meeting to have a test WebEx meeting with you all, possibly next week.
Is that our next agenda item to discuss the next meetings?
I can hold.
Yes, that's our
I can wait on that. All right, I can wait on that. As far as in reference to COVID, I don't have anything. Okay. Thank you.
Thank you, Ms. Griggs. City Attorney's Office, Bob Fournier.
Well, likewise, my remarks come under the next agenda item, so other than just to report that all of the attorneys are working remotely successfully and are reachable via email or cell phones, I'll pass till we get to the next item.
All right, thank you. Anyone from Development Services have joined the call yet?
Yes, Gretchen Schneider's here.
Right.
And just to report that our offices, we are accepting permits via Dropbox, and so we have quite a number of staff that's out doing inspections and processing permits.
Thank you, Ms. Schneider.
That's all.
Thank you. Financial Administration, Kelly Strickland or David Boswell, related to purchasing.
Good afternoon. This is Kelly Strickland. I just want to report that most of my staff are working remotely. One of the items that we're working on is the upcoming budget. But before we can do that, we have to see what's happening for our budget for this fiscal year. So we're looking at revenues and expenditures that we're going to incur during this COVID season and to get a report to you on that.
And Marlon, can I just say something here for the commissioners?
Sure.
I know I've got several individual questions from commissioners in terms of fiscal impacts of a situation like this. And just some general summary information. 47% of our budget is our property taxes, ad valorem taxes, and those have been over 90% paid to date. There's been an extension of the payment period for, I believe, a couple of weeks. But generally, municipal organizations aren't on the front end of taking economic impacts. We'll take them, but they'll be down the road a little bit, and then we'll be maybe at the tail end of the recovery. But the second biggest component of our budget is about $10 million in shared sales taxes and communications taxes and the revenue sharing taxes. And those are, I think, done quarterly and then shared according to a formula. So I'm sure we'll see some downside reductions there in the not too distant future. And of course, the local gas tax and local sales tax, same thing. We're obviously going to see a dramatic reduction, at least in the short term, of those revenue resources. John Legge, is there anything else that's an important sort of overview highlight to hit on in that regard?
Nothing. I think you hit on it. We're looking at projections and making some assumptions in those, what I call economically sensitive revenues, the sales tax revenue, communication services tax, the ones that are really run the economy. And what we'll be doing we're constantly monitoring those revenues as they come in addition to fees and other revenue sources. And so we'll be looking at, as we move forward, making some assumptions in the reductions of those revenues, whether it's 10, 15, 20, 25%. And then we'll be looking at the other side on how to mitigate that with expenses and expense reductions. And so we'll be continuously monitoring that. We will provide a report to the commission in the next couple of days. I think Ms. Strickland is working on a report to provide to the commission that will outline a lot of those revenues and those types of resources.
And in terms of immediate reaction or response, of course, as I mentioned, 76% of our general fund are payroll pay positions, but almost all of our part-time, if not all of our part-time employees, we have a significant number, are not working at this time. All of our essential services continues, and some of our full-time folks have been moved around to deal with issues, and we're continuing to keep our fingers on the pulse of the community to keep our ear to the ground for any unmet needs out there that we may be called upon to fill. And other than that, Stacy, when we get to her in HR, they may have some other information, and they're certainly reviewing the CARES Act, and we're working carefully with our colleagues in our region to understand what they're doing as well.
All right. Thank you, Mr. Bowen. Purchasing, David Boswell, did you have anything to add to finance?
No, sir. We're just still working on making sure we have proper protective equipment. I want to thank Mr. Kerpring for assisting with that, and that's all we have. We're still doing bids and RFPs and working on projects.
Thank you, Mr. Boswell. Human Resources, Ms. Mason.
Hello, good afternoon. This is Stacy Mason for the record. I wanted to go through, as Mr. Barrow had stated, some large overviews of what we're working on in our department, but we are seeing that our essential and critical functions are still being staffed. So we're at a fairly large staffing level. We don't see a lot of impact with time off or sick time at this point in time for those critical functions. Employees that can work remotely have been. We started that process at actually March 23rd. We accelerated it as of April 2nd. We are reassigning and retasking employees in different projects as we can. So we're moving some staff around to affect some projects that maybe have been put on hold. Mr. Barrow also stated our temporary and part-time supplemental staff have had reduced hours since March 20th. There are approximately 133 part-time and supplemental staff on our payroll. We've also initiated, as per the Act was required on April 1st, informed all of our workforce of the Family First Corona Response Act. If they are applicable to any paid time, well, they cannot work for the city and they're not in essential functions, we're processing those requests. Our Employee Health Center remains open to support our staff at this time. Obviously, they need to call and talk to the provider before they enter our facilities, but we're keeping that staffed as long as our essential medical staff can keep that staffed and open to support our employees. We have also modified our medical benefits for employees that are on our city medical benefits, that it covers the cost of COVID testing and any lab or doctor's visits related to that. My staff are also working on numerous pay questions and benefit questions at this time. That is our update. Thank you, Marlon.
Thank you, Ms. Mason. Information technology.
Yes, sir. Emilio Rodriguez, for the record. IT successfully moved the city to remote work. Our internet bandwidth and phones are holding well. We're holding the line. 80% of our staff is successfully working remotely and supporting the city.
Thank you,
That's all I have.
Thank you, Mr. Rodriguez. Planning.
It's for the record, Steve Cova. Within the planning division, all of our staff are working remotely. We are currently working on over 16 zoning text amendments. We're reviewing projects and plans, and we're continuing to move forward with our Sarasota in Motion transportation plan. So far, remarkably, it is still on schedule. Now, I would like to pass it on to Cindy and Mark for updates. Let's start with Mark in parking.
Thank you, Steve, and commissioners. Thanks for your time today. Parking is moving along. We continue to, of course, protect the liability that exists with our facilities, and that is making sure that they're clean, safe, and watched over carefully during this time. We have reduced operations as much as we possibly can while still making access available to the general public. Our enforcement team has scaled back, and we are, of course, the eyes and ears during the day for the city, and so we continue to monitor safety issues, and our team continues to work on, of course, this year's budgets and new planning developments around the city of the Bay and a couple other items, and that is it. Thank you.
And now Cindy from the Office of Housing and Community Development.
Thank you, Steve. I wanted to let everyone know that the allocation amounts for the CARES Act CDBG funding has been received. the city will receive $257,726. And based on conversation with HUD reps, HUD does not have further details to release at this moment. As they become available, I will keep administration informed. The County Emergency Solutions Grant will be getting an additional $508,541, and that will largely be used, of course, for the homeless. I've already reached out to the Suncoast Partnership to End Homelessness, as they are the COC for Sarasota, and have been discussing potential uses for ESG once the county receives that funding. As far as our office goes, we are working remotely, and we have about 30 clients that are in various processes, from initial eligibility to getting work done, and we are trying to facilitate emergency projects for home rehab, such as new roofs that are needed, air conditioning units, and outside plumbing jobs. We are not asking anybody to do repairs inside the home.
Excuse me, Cindy, just one second. Thank you. Somebody is not muted. Can everybody please check your phones to make sure it is muted? We are getting some background noise. So if everybody would kindly do that, I would appreciate it. Cindy, you were finished, correct?
All right, thank you. Parks and Rec, Mr. Fogel.
Yes, just a couple of things. Jerry Fogel for the record. So basically, we have the majority of our staff, landscape division, are obviously still working. What we've done, and Candy Peterson has worked diligently to separate all of our staff, so they're not riding in the same vehicles, they're not riding in the same golf carts. They are actually, some of them are taking their personal vehicles to sites, to the work site. They have an app on their phone that they can actually clock in and out with. So, I mean, we're just trying to, like I said, obviously these are tough times to be creative, make sure that our staff are able to get their jobs done in a safe, healthy manner. But majority of them are working on site. We have some that are working at home. And then we have some recreation programming staff that are just being very creative with videos, virtual videos of different things for the community to go and click on to do, such as reading books, doing arts and crafts, things of that nature. So we're trying to still stay connected with the community and also make sure the community is connected with one another. So those are some of the items that are going on. One other thing is Bobby Jones. We shut Bobby Jones down as far as the staffing goes too. So there's no staffing, no one working out of Bobby Jones currently. And that happened last week.
Thank you, Mr. Fogel. Public Works.
Jeff Code for the record. Like Jerry, all of our essential functions are still operating. Working with social distancing with our staffs to try to keep them apart when we can. Road and traffic operations still have construction going on with roundabouts and several other projects. Fleet operations still trying to maintain and make sure that we get all our fleet up and running and continuing to support the outside organizations. Solid waste, probably one of the biggest operations right now. What we're seeing with people being home, a lot of yard waste and a lot of bulk waste. So we're kind of watching those trends. That is a cost as the tonnages associated to those go up, but we'll keep an eye on those trends. That's it.
Thank you, Mr. Jeffcoat. Police Department, Chief DePino.
Yes, Chief Bernadette DePino. For the Sarasota Police Department, we are ensuring that our personnel have the equipment that they need. We have protocols in place to reduce their exposure and increase their safety during this pandemic. We have a telephone reporting unit in place. To date, based on the executive orders, we've had 59 reports of people violating the order, but we have made no arrests nor have we cited anyone other than verbal warnings. And we are continuing to practice the mantra of educate, encourage, and enforce if necessary. So I'd like to take this opportunity to ask the community to continue practicing the social distancing, cooperate with police, and to follow the governor's and the city manager's executive orders, because the lives of our first responders are placed in jeopardy when people fail to follow those orders. And we are in this together, and we are here for the community, and we'll continue our operations. And that ends my report.
Thank you, Chief. Utilities, Bill Reby.
Bill Reby for the record. We continue to deliver all services while still observing all the CDC guidelines as much as practical. No major issues to report. That's all I have.
Thank you, Mr. Reby. Van Wezel, Ms. Bensel.
Hi, Mary Bensel here. Well, I moved or canceled a few, about 20 shows, and then we worked with our customers to get the information out. With most of the shows that were moved to other dates, we're encouraging customers to hold on to their tickets and use them next year. If not, to do an online credit, a donation to the Van Wezel, or at the last resort, a refund. I also had to work with numerous rentals. Tom may have mentioned that on the day this all happened, the major organizations, the arts organizations in the city as one, decided to close that night, which meant the Sarasota Orchestra performances at the Van Wezel went dark that night. And everybody was extremely cooperative. We've started a new initiative with the Van Wezel Foundation called Van Wezel Artworks Anywhere. This is an education initiative that is an online program with activities for parents and students along with curriculum, and we're doing this in concert with the Sarasota County School District. We filmed it at the Van Wezel the other day, practicing social distancing, and we stressed our thank yous and how much we felt towards everyone from grocery clerks to police officers to the health industry. We also did 3 or 4 PSAs for the city. At the urging of the Herald Tribune, we are sponsoring a virtual cocktail hour with Paul Madison making a mocktail cocktail that you can, we'll tell you the ingredients ahead of time, and you can make it along with an hour's worth of concert from Chantel Norman. And that's going to happen on April 17th. We are hoping to do something in concert with the major concert being held on the 18th on all television stations. We announced today our big show of the year, Come From Away. We were able to move, and let me tell you, it took a lot, to the week of Thanksgiving. And so we're going to move all of our patrons to that week, hopefully. We are announcing our Broadway and classical shows at the end of the month. Our brochure has gone to the printer today, and press releases are in the way of going out. We're working on booking the rest of the season, which was a big challenge because it's part of this year and next year. With Friday Fest, we're looking at guidance. We hope that we can definitely do the August and September Friday Fest, but we're just looking for direction from the government, from Tom, and from the president, of course, as to whether we can do the June and July ones. And Tom stressed what he wanted to make sure we did was make this a festival of celebration. We're all coming back together. So I think Friday Fest is a great way to do it because it's outside. Next week we have the TDT grant that we have to defend online. We're working on other grants with our grants administrator and with the cities. We're looking at the NEA grant. And then we're working on calls with other theaters nationwide. And then we have 2 calls every week with the Florida theaters. So we're coordinating in concert with them. And that's the end right now. Thank you, everyone.
Thank you, Ms. Bensel. Economic Development, Steve Stansel.
Yes, for the record, Steve Stansel. The Office of Economic Development continues to work with Laura Wittenbauer and other economic development professionals from the county, EDC, local communities, and organizations in monitoring and implementation of programs identified in the CARES Act, as well as local, state, and county incentives. To give you an example, Friday was the first day that small businesses could apply for one of the larger programs in the CARE Act called the Paycheck Protection Program. There's $350 billion in the CARES Act for that, and the money comes through loans through SBA certified banks. And so the Chamber of Commerce had identified the local SBA certified banks. We were able to get that information out to all of our businesses and business organizations to get out to their people. Literally, the guidelines for the program came down to the banks Thursday night, and banks could start giving the loans Friday. And by the end of the day, Friday, more than 2,300 loans across the country had been given already, totaling just under $900 million. I saw an article today where the Bank of America has had since Friday 85,000 applications totaling more than $22 billion. And one of the other larger banks, Wells Fargo, has had more than $10 million of requests. So there is some concern that $350 billion may not hold up through time. One of the issues, just to let everybody know, is that the banks can provide some of their own guidelines. And what Bank of America has chosen to do, and some of the other banks have chosen to do, is to provide funds to businesses that they've already had a working relationship with. And so that has caused some concerns throughout the country about how if you're a small business and you don't have a current relationship, it may take a little longer to get funds. The other issue that's out there is there's been more than 10 million job claims in the last 2 weeks, and this has stressed state agencies. For the most part, these agencies had reduced staff because the unemployment rate was so low. But now that it's skyrocketed, they're having to scramble to even get enough employees to be able to process the unemployment claims. And you may have seen a proclamation from Governor DeSantis where he's requesting all other state agencies provide employees to the DEO for their assistance. We continue to participate in an economic recovery roundtable, which is made up of local economic development professionals, and we do phone conferences on a weekly basis. We discuss what each community is doing and ideas for some local potential programs. And that's it.
Thank you, Mr. Stansel. Let me have Ms. Wittenbauer. Anything to share to Mr. Stansel's comments?
Yes, sir. Good afternoon. For the record, Laura Wittenbauer. With regard to some of the areas, and it looks like there's going to be so many loans that the money's going to get exhausted fairly quickly. The federal level, they're discussing a fourth CARES Act, and this will basically go in and fill these holes that they weren't aware of previously. So that's in conversation right now. The president is basically looking toward recovery, which would be more of your transportation bills, but the Senate is still focusing on the COVID-19 CARES Act. With regard to the CARES Act currently, Cindy did mention under HUD a homeless assistance grant, and I did speak with Michael Willis, our federal lobbyist, today. And he states that there's going to be additional funding coming through different programs, but those programs have not been identified as of yet. So we're keeping an eye on that so that we can work with our homeless outreach team. With regard to National Endowment of the Arts and National Endowment of Humanities funding, I found out today that they are really focusing more on museums at this time because having no attendance or people paying fees to go into these museums is costing them. And so they're trying to come up with means of having a virtual tours of different areas of the museum to try to raise some funds. And also they're having issues in maintaining these facilities. So that's ongoing. I think that's all I have for now.
Thank you, Ms. Wittenbauer. Facilities, Mr. Shanley.
Yes, we have the majority of our staff still on site, and what we are concentrating on doing is cleaning and maintaining our buildings and working on some larger projects that are easier to do with less employees in the workplace. So as well as we are supplying supplies that are much needed to the departments that are on site and working. We are working with purchasing to get those supplies. Since we are here, we're accepting delivery of those supplies and getting them to the workforce that are still here on site working in the front lines. That's all I have.
Thank you. Homeless response, Ms. Fraser.
Hi, Crystal Fraser here. We are continuing to work remotely from home. I'm not having any issues with that at all. Good news is we are still continuing to house clients. We housed 6 last week. We continue to house, I think, about 4 this week is how many we have scheduled. Other than that, we're not seeing any decline in our ability to get resources to clients. We're continuing to make sure that we're in contact with the Suncoast Partnership and the Salvation Army, and that is all we really have to report at this time.
Thank you, Ms. Fraser. Public information, Ms. Thornburg.
Good afternoon, it's Jan Thornburg. We are working remotely regarding public information. We ramped up very quickly, and we have been responding in a very significant and meaningful manner, focusing primarily on 4 areas. First is the traditional media. We are continuing to
Ms. Thornburg. Ms. Thornburg.
Every day.
Yeah. You are muffled. I don't know if we can hear you much clearer than that.
Can you hear me any better?
Not really.
No.
Okay. Maybe I'll try speaker. Hold on.
We can hear you fine on
any
the phone.
Can you hear me any better?
Yes, that's better.
Yeah.
Okay. We're working on 4 major areas with our daily communication regarding COVID-19. First is with the traditional media. We are working closely with our messaging regarding city issues directly with the traditional media. Social media, we are working closely with other agencies with very specific messaging. With our emergency orders, looking to the Florida Department of Health, Sarasota County, the CDC. We're sharing our flash reports. Give you an idea of the sort of messaging that's been going out over the past few weeks. We have posted a total of 340 social media messages. That's a reach of 980,000 individuals. We have also really ramped up our newsletter. We have created a special COVID-19 newsletter that is going out whenever it's necessary. Sometimes it's twice a day. And that is going over very well. People are very appreciative of the information that's being provided. In fact, our subscribers for the newsletter have gone up 20%, working on that while continuing to work on our regular newsletter as well. We've also been focused on the website. We have good information on the website at sarasotafl.gov. There is a message at the top of the homepage indicating that people can go to a new specially created COVID-19 page. If you go to that page, you can go to it directly by visiting sarasotafl.gov/COVID-19. There on that page is a repository of all kinds of information. It's essentially one-stop shopping for people. They can read the governor's executive order. They can find information on business resources, social services. The commissioner's public service announcements are posted there, and also a direct link to the Department of Health dashboard. By the way, as the city manager did indicate, the 4 PSAs that have been recorded and have been put out on social media have gone over very well so far. with a reach of about 40,000. We continue to work, as I said, with the media every single day, and as necessary, we are getting the messaging out. Would really like to thank support that we've been getting from the Van Wezel. They have helped us out with graphics and also the production of the new web page we were able to get out. We've had assistance from the Parks and Recreation Department with monitoring of our social media channels, and also the clerk's office with the videotaping and editing of the PSAs.
Thank you, Ms. Thornburg. And last but not least, sustainability, Stevie Freeman Montes.
Hi, good afternoon, everybody. We have been able to successfully transition to remote work, and really have just been balancing, our grants that we receive through the National League of Cities, the USGBC, and our Partners for Green Places grant, how to postpone some things and continue on with implementation of other things within those grant projects. We also have a water quality project that's set to be installed, which can be done with all the social distancing guidelines in place, and that's supposed to go in on Wednesday, and we're really reflecting on how to maybe still do an Earth Day event virtually somehow, or a campaign, and how we can kind of restructure the festival that had to be canceled. So we're kind of focusing on all of those things, coupled with what data we might be able to collect during this time to help inform, resiliency into the future. So that's been our focus the last couple weeks. And that's all.
Thank you, Ms. Freeman Montes. Madam Mayor, I don't know if Mr. Bowen has any last words related to staffing and the departments.
Just a couple things, Marlon. Follow up with the homeless. We're seeing some interesting dynamics. There are less bigger crowds as of the last 10 days, but we still are having some aggregation in pockets around the community. There is a coordination call 3 times a week with all the homeless agencies talking. The most recent conversation is beginning to explore if this is going to go on another 3, 4, 5, 6 weeks and things get even tougher out there. What options do we have? There is some background conversations going on now about potentially aggregating or organizing a place where people can eat and practice personal hygiene, yet still practicing social distancing CDC guidelines. So I will keep the commission and community updated as that conversation continues. Now that there's a funding source, some of those decisions may become a little bit easier or happen a little faster, because this has been being discussed for the past 2 weeks. One of the biggest things that people are doing is getting out to exercise. It's very important. As Jerry Vogel noted, the public parks and our open spaces, for the most part, remain open. We are seeing better compliance with bridge walkers. We're now working with FDOT in almost real time to try to, because it's their asset, it's their roads, but to try to get better compliance for walking the right way. And the right way is with traffic on the right side of whatever way you're facing. So we'll continue to improve signage with the hopes that that can remain open and will not have to be shut down if people, refuse to listen. Those are 2 of the bigger open-ended discussions. We've tried to work closely with our colleagues on the Gulf Coast to try to move whenever we can regionally. Although Sarasota County did not close their boat ramps yet, at least as far as I've heard, we did have to close ours, because once Manatee closed theirs, we were inundated. We were just jammed. The Van Wezel parking lot was filled with boats. And during good times, that wouldn't be so bad, because they go into the supermarket across the street and buy whatever you need for a nice time on a boat. But in this particular situation, we felt it was important to protect our supermarket workers and the people living in these neighborhoods to go ahead and follow Manatee's lead in terms of the closing of boat ramps, because it had an implication to us. The other thing that Manatee did that was not what Sarasota County chose to do was create a curfew. And there is a curfew in place at 11 p.m. in Manatee County now. It's fraught with potential, exceptions and how to enforce it. But we've been watching that situation carefully, and we haven't gone in that direction yet. The chief and I talk daily, multiple times. John and Marlon talk daily with all of our department directors, and I thank everyone for being so engaged. The mayor and I have consulted regularly on the extension of these orders on a week-to-week basis, these emergency orders and the rules associated with them. And Bob Fournier and his team have been invaluable in providing guidance to be sure, we pursue things that are aligned and legal, and we don't get too far out there. So I think those are most of the open, and most discussed subjects, just besides trying to help facilitate people who need the help the most, get the help, and continuing to encourage people practice social distancing.
Thank you. Thank you all. I know that we have some questions that are coming in from commissioners, and commissioners, I'm going to ask you for your questions in the roll call order that we did before. I know that some of you have texted me that you do have questions, but I'm just going to go through the roll call just to be sure. So to start with, let's ask Commissioner Alpert if she has any questions of city staff or the city manager pertaining to any of the items that were just mentioned.
Yes, I wanted a little more information on the homeless issue. I'm glad there was an update that we're working on that. But where are we encouraging them to be able to go to, use a bathroom or, some of those things that they need to do?
I'll just say this and then hand it off to Crystal. But they have been encouraged to go to the Salvation Army, who has restaurants or restrooms, and they're doing feedings, restrooms and doing feedings. But late last week, the Salvation Army began to express some of the challenges that they're facing with the social distancing. So that is what created that new discussion that I'm referring to in terms of, is there a better way to do this? So even the Salvation Army could adhere to it. And so that's what has initiated this conversation, is could there be a place where, meals can be distributed and some hygiene can take place, practicing these social safe distancing guidelines. Initially, maybe Crystal can talk about this, we saw people in the homeless community doing what everyone else should be doing as well, and that's social distancing. But it's real tough to shelter in place when you don't have a place. Crystal, do you have more details to get out there?
Oh, yeah, absolutely. So, what I had actually gathered today is I reached out to a couple of the community partners who are still providing services to the homeless individuals, face to face, and asked them what they were seeing, what the biggest issue was. And it came to my attention that I don't think that a lot of the homeless clients were informed that they can still go and get showers at the Salvation Army, and they can still use the public restrooms at the parks, even though the parks are not open. They were under the impression that, kind of everywhere was off limits besides the downtown bus station. So we're going to try and see if we can get that word spread out to them, that they know that they can still go to the Salvation Army. The Salvation Army did put in place some restrictions on their restrooms and showers, but I talked to Major Whiten this morning, and he said that he was going to have another meeting this afternoon on what proper protocol they can put in place so that way they can start opening those services back up to the clients. They are still able to get showers at the day shelter Remnant Cafe, which is out in the county, but she comes and picks up in a couple locations in the city. I spoke with her this morning, and she said that she would do her best to make sure to know that the clients can start, hearing that they do still have places that they can go. However, I am also, as Mr. Barwin had mentioned, starting to get toward the side of I'm not sure what we're going to do if it continues, because there were about 80 individuals, homeless individuals, that came to Sarasota County about a week or 2 weeks ago that were scheduled to work at the county fair, and then when that got canceled, they're kind of stuck here. So that may be why I think some of us are seeing some new faces downtown, ones that we're not used to speaking with before. That may be why they're not as familiar with what services are still available. But we're going to continue trying to work with, the home, SPD's homeless outreach team, as well as the community partners, to make sure we can get the word out of what is still available. And then, at the same time, still have the discussions of what do we need to plan for in case something else might need to further happen.
Okay, thank you.
Thank you. Any other questions, Commissioner Alpert?
Yes, I've got a couple more. One is the Lido Pavilion project still moving forward?
Mr. Fogel?
Yes, it's moving forward. So right now we are in the design is almost completed. And so we're waiting on to fix the shaded structure over the patio area. We've installed the furniture. You probably already know this. But yes, moving forward, the last thing we'll do is the renovation for the restrooms, and we'll hope to finish everything up by December.
Okay, thank you. And then my last question is, what is the city doing specifically to help out residents?
Mr. Barwin?
I think we're trying to obviously communicate as much as we can about the facts of the crisis. We have gotten a couple inquiries about the practices condominiums and apartments should be using in terms of their common areas. The health department has promised us some guidelines on that, and as soon as we get that, we will advance that. But I think the main thing, Commissioner Alpert, is we're here with the community, standing with them to really work through this challenge and innovate as much as we can, but the basic services all remain in place. The sanitation's collected like clockwork. We've suspended water shutoffs in our utilities department. Police are prepared and well equipped to respond to any call of any nature, although trying to get as much done virtually like everyone else when it's reasonable to do so. Other than that, our economic development people are looking at all options, and we'll continue to encourage donations for those who can afford to do so to the food bank, to the season of sharing for those organizations who can help with rental assistance, car repairs, things like that. So we're in continuous dialogue with these organizations and ready to support those efforts in any way we can, which I think is a way to support our residents.
Thank you.
Thank you.
I would just add we are looking tentatively at setting up a sort of a community assistance group. If there is some unmet need in the community that we're aware of, and this is where we really appreciate the commissioners and mayor being so connected with the community in terms of being our eyes and ears. If you pick up on something that really is a gap that needs to be handled, we're ready to try to respond. I noticed some of the pharmacies are now delivering. Some of the grocery stores are doing pickups. Meals on Wheels had a little drop in volunteers, but I hear there's been a little bit of a surge. And we're also promoting people donate blood, too, because that's another challenge that they've seen a dip in blood donations, and they need to keep that flowing. So those are all the things we're trying to promote through our communications and our personal contacts.
Thank you. Thank you. Is that it, Commissioner Alpert?
That's it for me right now.
Okay, thank you. Commissioner Brody, I know you had a couple of questions. Go ahead with your first question.
Sure. First, let me just start by thanking everyone for the work they're doing as an essential part of this community. City of Sarasota is just staff and everyone is just performing beautifully. My first question is for Mr. Boswell. As far as some of these essential products, PPE products, face masks, and N95 masks, do we have any direct relationships with companies that we can get our own supplies, or are we generally going through the county system to try to acquire these products?
I think Mr. Kirkin can address some of that. The county has set up a system where we can go to them for some of these supplies. Rubber gloves we have been able to obtain from a local source. We actually got some today for the development services for the investors. And we have some masks coming, and I'll let Mr. touch a little bit on delivery of those masks. We're looking at a couple different sources for those, but those were ordered through the county, through the state program.
Okay, so
I believe
we don't have
Todd
any.
is on the county call.
Okay, yeah, and I've talked to Todd about that. That's okay. I've talked to Todd about that. He kind of refers to you for some more specifics on our ability to do that, but I'm glad that we're able to get at least some products. Anything you can think of to get more.
And we're still looking at stuff about those as well, too, about the mask and stuff. I probably get 7 or 8 emails a day, people offering masks, but they're 3 weeks out and they're very expensive. Most of them are not legit. Go ahead, Todd. I'm sorry.
Okay, Todd Kirkring here. Kind of let you guys know how the county system works is we have to try and attempt to get from vendors regardless of the cost. And then when we are unable to get items from a vendor, that's when we put in the request to the county who submits that request to the state. When it comes to the items, we have some of the extra large nitrile gloves that are in the system for the police department. The 15,000 surgical masks that we were going to request, I was able to obtain those through a vendor on Thursday and Friday. We should get our first batch of 5,000 sometime this week. So we're still supposed to go and find vendors before we submit the request to the state.
Okay, and we're doing that, but without much success, is what I'm picking up.
Well, mostly on the mask side.
Yes, the N95 masks are in short supply across everywhere. We've got orders placed for those. We've got a lot of orders placed on some other masks, the surgical type. When it comes to, it's hit and miss. Really, when you talk to a vendor, if they have it in stock, you need to buy it at that moment. If you try to say, let me go look for a cheaper price, by the time you circle back, it may be gone. So when you find a vendor with something in stock, you need to buy now.
Can I just interrupt you 1 second, Commissioner Brody? Ms. Griggs, should everybody identify themselves before they speak so that for the record we know who is speaking and not, because we know their voice and we recognize them perhaps for the record. All right, so everyone, before you speak, please just announce for the record who you are. Thank you. Commissioner Brody, go ahead.
Okay, and then as far as the financials go, this is of great concern. When can we expect some initial reports about how this is going to affect this year's budget and what adjustments we're making? I mean, I believe that we clearly need to implement a hiring freeze. We need to pause our capital improvement projects and other non-essential projects until we can kind of get a better picture on how this is going to affect this year's budget and also next year's budget.
So Finance is preparing a report. You should have it within the next few days. We have implemented a hiring freeze unless there's some special exception that we need to make. The fund that will be impacted most immediately, of course, is the parking fund because we're not collecting any revenues. But you should have a report on that. CIP is capital improvement plans may have been, we have out to bid. Some contracts, I believe, have been awarded. So we'll have to have an analysis of that done. That's kind of basic and to what we do. So, and those monies are budgeted with the funds that have been that are restricted to those purposes as well. So.
Okay, and also the projections, however those might change, the projections that we use when we calculate what our budget looks like in the beginning of the year, I'm sure is going to change for this year. We're not going to hit those projections. So whatever, I'd like that included in the report and report as soon as possible for us.
Yeah, so we'll continue to do yeah, go ahead, Kelly.
I'm working on that right now.
Ms. Strickland, Ms. Strickland, could
this situation?
Ms. Strickland, department directors, could you hold your comments until whoever is speaking is finished speaking, so we don't speak over each other? And then again, as the mayor alluded to, could you please identify yourself? So please wait until the speaker is finished speaking before you speak.
Ms. Strickland, go ahead.
Okay, I'm working on that right now. Obviously, our budget for this fiscal year 20 has definitely took a change. And before we can, do our projections for 21, we've got to see where we end. But I hope to have something to you this week on what our projections look like. As I said before, and I think Mr. Legge and Mr. Barwin said, our biggest areas that we need to look at are going to be our sales tax, our state shared revenue. One of the problems that I have projecting that is that we usually receive it in arrears 2 to 3 months. So it's a little bit hard to determine what it's going to do to us. However, I could do different scenarios, take it down percentage by percentage. Parking is an area of major concern. As you know, we've got debt payments in the St. Armands area. So whatever we are lacking this year, it's going to affect next year, the beginning fund balance next year. So what we're looking at next year probably are going to be higher subsidies to our enterprise funds in fiscal year 21. So we have to take that into consideration.
Okay, I appreciate all the work you're doing on that. That information is going to be critical for us once we get back into kind of a regular flow again to make some of these tougher financial decisions. My next question is for Police Chief. You noted that we still had some ongoing problems with gatherings. You noted 58 calls for gatherings and service. I am still, at this point, I'm in favor of a curfew, like Manatee County did. And I'd like to just hear the police chief kind of give her perspective on whether she thinks that would be beneficial or not.
Chief DePino?
Yes, Chief DePino here for the record. In reference to the curfew, I have concerns that Manatee County has a curfew and we don't, which could lead to, just like the boat ramps being closed in Manatee County and not here, that's one of the considerations for closing the boat ramps, was that we would get an influx of people coming here. This coming weekend is traditionally a very busy weekend with individuals celebrating all throughout the city. And the potential for a curfew has its merit and benefits. It wouldn't be any different than what we are enforcing now, other than really restricting people being outside at certain times, whether it be 10 p.m. or 11 p.m. We are utilizing the current executive order to educate people and break up different functions that are taking place, but I am concerned about the safety of our police officers, because when they have to go out to these functions, whether it be 20 or 100 people, we do have to engage with them. We are educating them, and we are getting cooperation from the community calling us when they see these large groups. So that would be a decision that would be up to the commission and the city manager to determine, but we would be prepared to enforce it if that's the direction you go in.
And if I could just have the city attorney weigh in on that, how we would do that, because I read the memo that he prepared, which cautioned had some legal issues with the direction Manatee County went, but I think that we have a pretty clear path to get it done if need be. You could just expand on that, Mr. Fournier.
Okay, sure. Bob Fournier, City Attorney. I won't reiterate what was said in the memo since that was sent Friday, and I know since then today I have not yet had the chance to talk to the chief or anyone at SPD about what the situation was this past weekend that we've been through. So I would say, first it would be my preference for the reasons that were articulated in the memo that we use the local emergency order. But if that turns out to be impractical or imprudent and it just isn't doing the job, then I think we have to consider something else. And in that case, I would want to, first of all, try and consult with the governor's general counsel about the issue. I think we have reason to believe they're very open to questions and communications from around the state. So I would like to do this in consultation with them if we have to. And I think that there's a far simpler approach if we go there than perhaps what Manatee County used, which would be simply an order that says that aside, I believe, from, of course, someone obtaining medical services, that you would not be able to obtain essential services between the hours of whatever the curfew turned out to be it 10 p.m. to 5 or 11 to 5, or you would not be able to engage in essential activities as defined in the governor's executive order 2091 during those hours. So I think that would be the simplest way to go about it. You've got the other issue of provision of essential services. We might have to tackle something like convenience stores, which are allowed to be open, things like that. But I think I would want to approach it very simply that way, to just address curtailing some of the activities that would otherwise be allowed in the governor's executive order during certain hours, but certainly not for 24 hours. And to do that, first of all, after consultation with SPD, and secondly, after consultation with the general counsel for the governor.
Okay. Yeah, like I said, I'm in favor of that just because we have had some continuing problems around the city, but we have had a number of them in North Sarasota and at the various colleges and the schools. And as you all know, Manatee County put a curfew in place, and even outside of a curfew, we see a lot of young people come down from Palmetto and Manatee County to have a good time in Sarasota. But we can't expose our officers to that and the community to that. We just can't do it this time, and I think we should go as far as we can to try to prevent that. So with that, I guess my last question is, I guess more of a statement. One of the things that I've been looking for, and I've encouraged our city manager to bring information back to us, but hasn't really been able to get any details on, is the contingency plan. While not probable, but still within the margin of error, we could see our local healthcare system really under some pressure in the coming weeks. And I think that we really should know that there is a plan in place to expand our local healthcare system as far as beds go, that we have the staffing in place for those peak hour or those peak weeks that are going to be coming towards the end of the month and beginning of next month. And if there's anything that we can specifically do as a city of Sarasota to augment that or help in that effort, we obviously need to do that. But we haven't really heard or gotten any information from the county emergency center as to what that plan looks like and whether or not we have all the equipment and staff needed to do it. I am concerned about that. The Sarasota Memorial, which is going to take the brunt of this of this healthcare situation, is filling up beds. And just to kind of put it in perspective, they've, in the last 10 days, from the 26th to today, have gone from 9 beds filled with COVID patients up to 34 today. And that's just 10 days. That's obviously going to increase exponentially. And you know, I don't know what else we can do, but I do want to put that out there that I am concerned about having the required and necessary staff, having the required and necessary beds to absorb that, and also the ventilators. You know, the Sarasota Memorial currently, I believe, only has around 100 ventilators. 30 of them or so are used, and that concerns me. You know, as if not more importantly than beds, we need to make sure that we have ventilators. Our community is more susceptible, vulnerable than the average community in the state and country because of our elderly population. And I think that the resources really should be coming to where the need is. And the fear is, obviously, we're hitting this peak at the same time a lot of communities are hitting this peak around the country. So, you know, I just wanted to put that out there and obviously thank all of our first responders and essential workforce members and medical professionals who are battling this right now.
Thank you. Mr. Barwin, would you like to speak to
And I would, well, just briefly, and then maybe ask Todd Kirkring to supplement the comment, but I am in regular touch with David Verander, the CEO of the hospital. There's a standing and open offer to let us know if and when he needs help on any subject, any topic, any initiative that we could possibly help with. So that dialogue will remain open. That offer will remain standing. But Mr. Kirkring, could you give an overview of the contingency?
Excuse me, I'm sorry to interrupt. Somebody please mute. Please mute. We can hear background noise, coffee being poured or something.
Sounds like a refreshing drink someone's having midday. Todd, can you supplement the contingency planning for the hospital bed situation?
Sir, Todd Kirkring here. Just in the general terms, I know the county health department met with late last week with the different hospitals. I know that doctors in Englewood, as part of the HCA system, they have corporate contingency plans for that. SMH has the ability to surge an extra 200, maybe a little bit more. Venice Regional, they have the ability to surge on site as well. In addition to those different coordination efforts that they're taking place, Sarasota County Emergency Management, they also have an additional 1,000 medical cots that are designed for the people with special needs shelters, and they also have the medical equipment. So, I mean, in a sense, you know, the surgery centers around the county, I believe there's about 20 of them. They have those facilities that can be turned into different hospital-type wards. You have the Sarasota Memorial. They have their different off-site locations from the main hospital that they're able to treat people there as well. So we could also look at, if you wanted to even expand out, the kids are not in school right now, so there's plenty of options for additional hospital space that is there.
Thank you. Commissioner Brody, is that it?
Just to follow up, I appreciate that. I do think that we need to get down to specifics at this point, because this is going to happen or not in the next 3 weeks, and we don't want to wait until the last few beds are being filled before we start figuring out who and where additional patients are going to go, and most importantly is making sure we have the correct or accurate projection so that we can get the ventilators, the masks, the PPE equipment here, so that when we need it, it's here. Now is really the planning time for that. And I would like to see some more specifics, but I appreciate everything that you're doing, Todd, and the county towards that goal.
Thank you. Thank you. Perhaps, Mr. Barwin, in your weekly or daily reports, we can start speaking to some of that about what plans are in place specifically for PPEs and for ventilators, for masks, for quick testing or testing of any kind, and so that, and beds and ICU beds and so on and so forth. Maybe we can continue to beef up that sort of preparation and analysis so that we can continue to try as much as we can to stay ahead of this.
Yeah, and Madam Mayor, I just wanted to, one more thing. The testing is so critically important for us if we're going to be all locked down during this period of time. People need to have access to testing to know whether they have it or not. Once this starts once we become more open, so that they know whether they can continue to quarantine or not quarantine. But just so everybody on this call understands the import of that planning. Our community is 400,000 people in this county. Sarasota Memorial takes a big brunt of the responsibility of caring for them. The whole entire county only has about 1,500 certified beds at any given at all. That doesn't even count the people that have essential medical needs outside of this. So if we get up to a point where 0.4% of our population needs a hospital bed, we're overwhelmed. I mean, it's just the math. Right. And so I think that when I look at the projections, we definitely need to be planning that, and I would just urge more transparency in that so that we can all rest a little bit easy that that it is moving forward.
And we'll certainly continue to advocate for that. And Sarasota Memorial has been working on getting the testing to be able to be done right in their facility. They were very close, and then some equipment got diverted. Once that happens, that will be a game changer within that building and the community. And the canceling of all elective surgeries it's putting a pressure on their business side. It has had the good impact of opening up more beds for these emergency situations.
Thank you.
you.
Thank you. And just another mute reminder to somebody out there. Commissioner Shaw, I know that you text me with you had some questions. Would you like to go ahead?
Yes, ma'am. Thank you. To Mr. Fogel, looking out into the summer, I know we were looking at the summer program registration. Is that going forward, or is that canceled, or what?
Commissioner Jerry Fogel, Parks and Recreation. I am definitely going to go ahead and move forward with canceling that. I just, at the time, wanted to give an opportunity. Obviously, it doesn't appear there's no way in the world that we can have the summer camp, so I will get with staff this week, and we'll get out the word this week.
Commissioner,
thank you. To Ms. Fraser and the homeless outreach, I have found we have at least 37 people on the streets at night and in the morning around Sally from the 9th Street up to 6th. Is there not the possibility that we may use the Sarasota Fairgrounds as a staging area where we can Sally can put cafeteria, mobile kitchen, restrooms, latrines, but at the same point that I make, one of the areas in the heat map was zip code 34236, and that is a center of that. With those 80-plus persons beyond the people that we already have in our community, and you're placing another 10, where I'm finding them is in North Sarasota. A number of them have appeared there. Is there any way that we can get a greater spread, and is there any way we can look at the possibility of using the fairgrounds for housing? We have taken up the 12th Street, the Orient, the car.
Commissioner, the city has proposed that, and a couple of weeks ago, and the county health department and the coalition to respond to homelessness rejected that concept up until now because they were fearful that it would cause aggregation, which is contrary to CDC recommendations. We made the counterpoints that you could set it up in a way to be able to design the setup so you would be adhering to separation. I spoke with about 30 homeless people about this before we closed Five Points Park, and to their credit, they were very honest with us. They had questions like, well, can my significant other still hang with me? What about my pet? And what are we going to do in terms of security when arguments break out? And are we prepared, and do we understand that people are going to be withdrawing from various substance abuses under these conditions? And therefore, are we making security arrangements for the advent of those scenarios? And now, 2 weeks later, the powers that be and the health department are beginning to revisit that whole conversation. And the fairgrounds was a site that was discussed. The county health department does have an agreement of cooperation with the fairgrounds. I've talked to the director of the fairgrounds about it personally. He did not commit either way, but under emergency, we do have some extra powers and authorities. So there are reactivated discussions along those lines. But one of the most interesting facts that I've heard as of late, the chief briefed me on this morning, and Chief, if you're still on the line, you may want to talk about the overdose situation that we're seeing.
Yes, it's Chief DePino. I'm still on the line. Yes, we've got 5 suspected overdose cases, suspicious of potential fentanyl that we're investigating, and it's an increase from what we have been seeing lately.
That's
so we don't know if that's attributed to. Yeah, go ahead.
Yes, sir. I think it's attributed to. You got everybody in the one place doing the same thing. And we're going to see a greater number of these overdoses. We're going to see all of these things in place within one area, and it contributes to the health and safety of the outlying areas. When we didn't bring the boats into that same grocery supermarket, we're bringing them from the other side, from the homeless situation. So I'm saying that that conversation, if you need me to go to go further with this, we can do it. And I definitely don't want to sound negative here, but we aren't doing anything. I got 37 people sleeping on the streets there every night, at least, okay? And they aren't within social distance in their sleeping. Those are outside. They could be outside in a tent at the fairgrounds just as easy, where we have far more property. But let me move on, because that's going to get a bit. If you can't handle it, if you can't help me, say so. You know,
we'll keep you posted on it. That was our request to the health department. I believe it's being revisited. There are active discussions on that now, and we should be able to update you within a day or two on that.
Okay, but to the budget conversation, Ms. Strickland, how can we make projections, as the one commissioner was saying, with an ever-changing day-to-day event? I don't want to put you or strap you to doing something that we're going to get changes on next week. We aren't there yet, so we really can't say what it is. Florida isn't even on the peak yet until about May the 21st before we will even get to the peak, you know. So I kind of would not want to hold you to a projection that is going to be ever changing. It can't. I'm just lost there. Am I loose here?
Ms. Strickland?
Commissioner, yes, ma'am.
This is Kelly Strickland. I appreciate your concern, and it's not going to be easy. You're probably going to get a lot of estimates between now and when we issue the final budget of where we're at. One of the things that I can do is take different scenarios, different percentage and decrease of revenues. I also can take a look at when we were in a recession before, the past one, and see where our revenues were coming in then, as well as our past history. But it will be ever-changing, I believe.
Very well. And Madam. Yes, please.
Yeah, this is John. If I may chime in if I could. Yeah, one of the things I think is important is that we're going to have to base these projections on assumptions, and you know the assumptions might be how long is this going to last, how deep is it going to go, those types of things. And you know when you base something on assumptions, you know you kind of have to kind of see what plays out as far as reality is concerned. So I think what Ms. Strickland is correct in saying that we'll look at different scenarios with different assumptions, so we'll know what those assumptions are. Hey, you know this is going to last until May. We're going to start recovering in June or July or whatever. And as we get closer to those assumptions, we'll have to refine those along the way. So I think it's our duty to give some projections in some ways based on a set of assumptions. And so we'll outline those assumptions along with those projections so you have an idea of what the projections are based on. And as we come closer to reality, we'll adjust those assumptions to reality and come up with better projections. I hope that might help.
It helps. I only wanted to get that out, the points that you and Mr. Strickland just made to the others of us, that we can't have a concrete, this is what, and 2 weeks from now, it changes and you come back with another argument towards the staff. That's all I would say. I well understand, sir. And Madam Mayor, I'm done.
Thank you. Thank you. Vice Mayor, do you have questions and comments?
Hey, Madam Mayor, just as Commissioner Brody, just to correct the record, the peak projection is May 3rd, not the 21st, for Florida.
Thank you. Vice Mayor, do you have any questions and comments?
Yes, I do. Thank you, Madam Mayor. My first question is directed to Ms. Strickland, and basically just in addition to the information that she's gathering for the commission, I would just ask that you leave some room for fiscal impact from a pension perspective, and I know that that can't come directly through your office, but to include the folks that we work with on our pension analysis, and to recommend that there be another review of where we are post-COVID-19 in terms of maybe adjustments or different recommendations that might need to happen. I would imagine that the risk is different now based upon what's happened to the market as a result of this COVID-19 pandemic. So I would recommend that analysis also be included in some way, shape, or form as a part of the overall financial impact that's occurring with the city as a part of the overall reports that we're getting.
Vice Mayor, do you have another question or comment?
I do. I just wanted to make sure that she heard me. I didn't hear a response.
Ms. Strickland?
Yes, I heard you. Thank you. This is Kelly Strickland. I heard her, and she's got a good point. Thank you.
Okay. My next question, and this is either for Mr. Lyons in parking or Mr. Fournier with the city attorney's office. I have a question as it relates to the decrease in the parking revenue and the impacts on the language to our bond contracts. I don't know whether there's any language in the bond covenant that speaks to acts of God or anything that could remotely be consistent with what's going on with this pandemic that might give us some leverage to making some adjustments on the other side of this as to how we address our parking revenues. And so I would just ask that someone take a look at that to give us some forecast in the future once we come on the other side of this as well.
Mr. Fournier, do you have an answer?
Fournier.
Yep. Go ahead, Mr. Fournier.
Sorry, should have waited for you, Mayor. I have not looked at the bond covenants, but you are correct. That's where the answer would be. So I think that's what we'll need to do and then report back on that question. Thank you.
And then, Mr. Fournier, just on a more general perspective with regard to any contracts going forward, I don't know whether there needs to be additional language that speaks to our position in terms of being able to modify our contracts or our ability to do business with other folks as it relates to the impact of this virus. And so I don't know if there's language that is being used from a municipal standpoint as city attorneys that, through your work with other municipal attorneys that we should be including in our contract language. I would just ask that there be an overview of our contracts as well to make sure that from a liability perspective, there's not something that we should be including that we're not.
Okay, and I think as we go forward and certainly contracts are brought back, that's going to vary, of course, depending on the contract and the subject matter of the contract, but it is a point well taken.
Thank you. Another question that I have is, and it relates specifically to access to our public services as a result of the executive order, and this likely goes to Mr. Barwin, and maybe a recommendation that we can make to the governor's office as we get closer to April 30th. And there's two parts of this. As a result of the governor's order, there is a definition of both essential activities and essential services. And as a result, many of our public facilities have been closed relating to outside parks and public facilities like public libraries and the like. In relationship between the COVID-19 pandemic and census reporting, there is significant impact in the numbers of residents, both in our community and nationwide, that are actually responding to the census. And they're thinking that there's a direct relationship because this pandemic is so critical that people are just forgetting about responding to the census. And the city had given us the ability to create the Complete Count Committee in order to do specific outreach to include person-to-person contact to encourage folks to participate in the census. As a result of this COVID-19 pandemic, of course, we've been able to do none of that as a committee, and even the outreach efforts that included access through our public places like our community centers, our libraries, have been halted as a result of the social distancing requirements that are contained both within our local orders and in the executive order. My recommendation is that the city would support an expansion of the definition of an essential activity that would include access to public facilities to be able to have internet access to do things like responding to the census and applying for unemployment benefits and applying for small business loans and small business impacts either through the CARES Act or specifically to the Small Business Association. Those same folks who were impacted from a census standpoint may likely be impacted negatively on this side with regard to unemployment and small business as a result of the coronavirus. And because of the social distancing protocols, they are boxed out of public services and libraries and facilities where they could get access to essential services. So I think that going forward, the governor might be looking to municipalities for guidance as to, whether or not the definition of essential activities did what it was intended to do, or whether there were unintended consequences in the language that was drafted. So I just wanted to bring to the Commission's attention what an unintended consequence was of this in terms of census reporting and also access for folks in the home who are now laid off as a result of COVID-19 who might not be able to get access to a computer to go online and apply for unemployment benefits and the like. So those are things that as a city, I hope that we would bring to the governor's attention.
We can certainly, this is Tom Barwin. We can certainly communicate with the governor's office on all of those points. You bring up an interesting point about people not having access perhaps to computers, and maybe there's a way we can address that with our partners. Commissioner, I know you've been working hard on the census. Has it been extended? And if so, to when?
Yes, Mr. Barwin, the reporting period has been extended. They have not given a specific guideline, but because of the social distancing protocols, there is no person-to-person outreach being allowed right now. So there's no door-to-door contact that's being permitted. They're encouraging everyone to go online and do the telephone reporting, which is great if you have the access, but if you don't, cities like ours had created drop-in centers where you could go to Robert O. Taylor and go to Arlington Park to be able to report to do the census, and now those facilities are closed. And so they don't have access to those facilities. And if they are an individual that happens to need to apply for unemployment benefits, they now may not be able to get to a computer. And because of the reporting that you did earlier with them not having enough staff and employees, the telephone lines are so logged up, you can't get through to an actual person to call, the actual number to go through and actually apply for benefits. Just like you might want to call and do the 800 number to call and physically, go through the process of reporting, the census process by telephone. So it's the same impact, but for two very important keys. And just for reporting purposes, the percentages for self-reporting for Sarasota, we are at 40% as of today. The state of Florida is at 43%. And nationally, the nation is at 44.5%. And we know that, COVID-19 has had a significant impact on that because, of course, it's not front of mind for most families right now.
Great points. We'll do what we can, and we'll share a draft, whatever communications we can put together with you so you can supplement it if we miss anything. Thank you.
I just have a question.
Madam Mayor, just
one question of you, Vice Mayor. What were those numbers that you gave? The nation is at 44% and the state of Florida is at what percent?
State of Florida is at 43% and nationally is at 44.5%.
Okay.
And Sarasota is at 40%.
Okay, thank you.
So we're 4% below the national average and 3% below the state of Florida.
Thank you. Go ahead.
Yes, my one final thing is, and it gets back to the funding that's available under the CARES Act for states and municipalities. There are three major blocks of funding that can go to states and municipalities for impacts as it relates to the coronavirus, but there has not been regulatory authority as to how those blocks of funding gets distributed. The Treasury Department is the one that is providing that regulatory language, and they have placed other more vulnerable populations ahead of governments in determining how they get their pots of money, understandably so. But for our conversations, we don't have guidance as to how we get the money that we are entitled to for reimbursement for losses related to the virus. Three big pots of money. One is $454 billion, another is $150 billion, and the final pot is $339 billion. And they call those pots emergency funding to states, local governments, and communities, and they're for different types of losses that communities face in relationship to the virus. And I know that Steve and Laura and the team are on the ball. Thank you for that. But we've really got to press our national elected officials to make sure that they don't delay and that governing guidance as to how local governments become eligible and actually receive those dollars so that it can get down to the cities where it's needed. They talk about providing the funding for equipment and the PPEs for hospitals and the military and the like, but they don't talk about necessarily governments and municipalities that have folks that work in the community that also need that protective equipment. So again, we kind of fall into this kind of gray area to where we have spent the money and have the need, but we're last in line to be reimbursed. So I just hope that we can get those questions answered as soon as possible. Department of Revenue is receiving over $1 billion as well, and it's for overtime, PPE, and medical needs, and there's no match. And so there's requirements that are there. So the funding has been allocated, but there's no directions as to how to receive the dollars. And so to Steve's point earlier, I don't think that those dollars match the need, and we don't want to be behind in requesting money that's already been expended. So.
Thank you. Thank you. Are those your comments and questions? Are you concluded?
One more, I'm just asking with regard to Cindy M. Hoff and our Office of Housing and Community Development. I'm wondering if there's a way for us to look at the agreements that we have with borrowers who have received money for renovations to their home and the repayment schedule. If they have been affected by the coronavirus, if there can be some relief to those that are making those repayments so that they don't end up in a default situation. And I know that there is a moratorium right now on foreclosures and, evictions. But if we've got folks that have borrowed money and they were making repayments and then they got behind, if there's some way that we can have some exceptions for those if they've been laid off or lost their jobs or have some type of, COVID-19 issue, that they can get some type of a payment extension or waiver.
Cindy Emshaw, Office of Housing and Community Development. Thank you for the question. And yes, I am looking into that, and I will give administration more information based on my research. So we are happy to do that. And the loans are 0%, 30-year deferred typically, but people who may not be using it as their primary residence, we will be glad to deal with them on an individual basis.
Thank you. Thank you.
That'd be great. Thank you. Mayor, that's all I have. Thank you.
Thank you very much. I have just a couple questions. My first is to the police chief. I wanted to ask if I understood correctly that our police department does have enough masks and PPEs for their protection.
Hey, this is Chief DePino for the record. Currently, we do have masks and protection for our officers, and we have ordered more and should have sufficient to last for a period of time, and we'll order more as we move forward.
And Chief, what is that period of time that you have supplies for currently?
It depends on how often that they are used, and with the protocols we have in place, we've actually are looking at, as soon as we receive the additional masks, as making it mandatory for officers to wear the surgical or some type of protective mask as the CDC is recommending. But the N95s, they're being used when there is a suspicion of COVID-19 exposure or someone that displays the symptoms of it. So the turnaround time would be dependent upon the use. So it could be anywhere from, if it's used constantly, we could last 20 days to, we could go up to 6 months, depending on our exposures.
Okay. And the same question is for the city manager. How long do we have enough protection for our city essential workers, as well as what timeline, how far out do we have those supplies?
Tom Barwin here, Mayor. Mr. Kirkering submitted, and it sounds like he's been successful in securing masks. So when he was asked to do that, it was for a 30-day supply, understanding how many people in the country are demanding these masks. We felt that was a reasonable request. Mr. Kirkering, do you have anything to add to that?
No, sir, not at this time.
Okay.
So that was, I believe, several thousand masks.
And what's the period of time, Mr. Barwin, you think that will last the city?
30 days with all of our employees who are interacting with the public, having a fresh mask every day.
Okay, thank you. My next question is for Mr. Barwin as well. I know that there were some brief discussions about our city's tenants and any sort of a rental abatement program. Has there been further discussion, and if so, what is that discussion?
Mayor Tom Barwin, the Finance Department is looking at that and the various leases that we have in place, and they'll be formulating a smart, fair response to that, yes.
Okay, thank you. And Mr. Barwin, you had also mentioned to some of the commissioners when they asked about the budget, and we would get an update on that. Do you have a sort of a roundabout idea of when that would be?
Well, Tom Barwin again. Kelly has drafted an initial report on that. I think she's got to do a little more analysis, but I would think by week's end, certainly by your commission meeting next week, which is the next subject of this conversation. The good thing that we've done here in the recent past is, and not to leave one with an overly optimistic view of things, because we just don't know how far this is going to go or how deep it will become. But we have prudently reserved funds here just for the event of an emergency, and that's why you do that. So we do have a bit of a cushion, not to put anybody at ease, but I think at least for the next few months we can absorb the body blows and plan accordingly. And many of us, unfortunately, have lived through some very, very challenging times economically, and so I think the tools and the options and what's coming is relatively fresh on our mind, and I think we'll be able to tap into our recent experiences if this is projected to continue for any length of time.
Okay, thank you. Mr. Fournier, I have a couple questions for you. Do we have a response on that shot clock and our development applications?
Yes, we have both at the state level and the local level. We have entered an emergency order that suspends the running of that shot clock as for the times that staff would have to process those applications. And of course, at the state level and also at the local level, the times by which site plans would expire, that's been extended as well. So you have extensions on both sides. So hopefully that will take pressure off when the emergency is finally over, to provide some time to review and to process those pending applications.
Thank you. And then I think that there was a little bit of confusion, and maybe I missed the email about the city being able to go above and beyond what the governor's orders said per items like gatherings. You know, the number in there is 10 or more. Would the city be able to say 2 or 3 or something that is more restrictive than what the governor has issued? And I don't mean very specifically just gatherings. I mean anything that we would deem appropriate for our city. Do we have that authority?
Well, I think the best way I can answer that is there is a particular statute in the context of the State Emergency Management Act that says that a local emergency order may not conflict with a state order or the governor's order, an order entered at his direction or her direction. So what the test for conflict would be per the Florida Supreme Court for statutory conflict, I think applies here, and that is you are not able to specifically allow something locally that a state emergency order expressly prohibits, and then conversely, you could not prohibit something locally that the state emergency order would expressly allow. And a lot of people have been somewhat surprised that the governor's order specifically says that, for example, attendance at a religious service in a house of worship is specifically enumerated among those essential activities. If the order had simply been silent, I would have no concern that could be prohibited in a local emergency order. However, it gives me pause because it is specifically allowed under the state order. Therefore, I think it would be a conflict if the local order were to specifically prohibit something that the state order specifically allowed, because the state statute says in effect that the local order would then be a nullity. So that's the problem we're looking at in that context. But if it's not specifically addressed, you take the position that the state order must expressly either prohibit or expressly allow, and then you can look and see, just applying the two questions I just recited to determine whether or not there would be a conflict, and if not, then we would take the position that the local order is something that is permissible.
Okay, thank you. Mr. Alliance, would you mind just expanding on the creation of your curbside to-go areas in the downtown area so that the community and the staff are aware of that in case nobody is? I thought that deserved some highlighting.
Thank you, Mayor. Mark Lyons, Parking Division. Yes, almost immediately within the first week, we decided to work with the businesses primarily affected by the meter program and identify designated parking spaces on Palm Avenue as well as Main Street where pickup, whether it's restaurant or retail store, could utilize and direct customers to these spaces for their purpose. And so we purchased 50, 60 signs, had a format that sort of gave it a zippy look and was easy to see. And we posted those signs up in cooperation with the stores that were interested in seeing those spaces identified. So it's been pretty helpful. I think obviously there are a lot of spaces available, but from the standpoint that it aids in the promotion of these services out there, I think it was quite helpful. We did the same thing down at St. Armand's as well, and they've taken advantage of it. And of course, we suspended any type of citation or violation that might otherwise be caused if somebody put their own sign out on the street and blocked off a space for their customers and so forth. I think a lot of stores and restaurants have really appreciated that effort. So thank you for asking.
Thank you. Thank you for the update. My next question is to Mr. Fogel. Do you have any updates? I've had some emails about Bobby Jones and the maintenance of Bobby Jones and what the projections of all of that look like.
Madam Mayor,
Mr. Brown, do you want to?
Madam Mayor, if I may. Based on the Commission's last direction to bring back a transition plan, staff is working on that right now with a couple of options. One is obviously to shut Bobby Jones down with the pending, renovations of Bobby Jones. So you will have that information coming to you. One will be just to continue operations with 18 holes, including the Gillespie course. And then one will be obviously full operations. So we'll be bringing back those three scenarios. So you will see the numbers, you'll see the maintenance costs, and staff will have a recommendation, and you can make an informed decision as to how you want to proceed.
Okay, thank you very much. Mr. Jeffcoat or Ms. Davis-Shaw, either one of you, would you update us on the opening of the 10th and 14th Street roundabouts, please?
Hello, this is Alex Davis-Shaw, City Engineer, for the record. In speaking to them, I haven't got an update yet today, but as of last week, they were expecting to open the first intersection to operate as a roundabout next week, be 10th, and then the following week at 14th, do that conversion as well. They are working on getting some approvals from DOT for some work there to get that work finalized. They had planned, as you know, to have some public meetings and educate people on how to use the roundabout, and some of those had to be canceled. We are working on getting our video clips finalized in the next couple of days, so we're hoping that we can at least get that out to everybody by the end of this week so that they can start watching that before the roundabouts open up next week. But I should get a update tomorrow when they have their progress report to see if they're on track for that.
Okay, thank you. If you wouldn't mind just letting the commissioners and or the city manager know so that when the constituents ask us, we're able to send out that information. Thank you.
You're welcome.
And my last just a comment I wanted to make pertaining to all of this was just to go off of what Commissioner Brody was talking about being prepared and staying ahead of everything, especially per hospitals and beds and ICU and testing, you know, that's an area of great concern. And as much as we can inform people and get supplies and prepare for this, I think the better off we will be. So if there are no other comments, I don't see any texts from anybody for additional comments to this agenda item. So since I have none, I think it's time and appropriate to move on to the next agenda item. Unless nobody's texting me. All right, let's move on to the next agenda item, and that's the discussion of our next meeting. That involves Mr. Rodriguez and Mr. Fournier. Why don't we ask to hear from Mr. Fournier first about the legal issues conducting our next virtual city commission meeting, which will be conducted by video. And then we will hear from Mr. Rodriguez, but I believe Ms. Griggs would like to speak first. Okay, Ms. Griggs goes first.
Thank you, Shayla Griggs, City Auditor and Clerk. We will be scheduling meetings with all the commissioners and city staff to have a test WebEx meeting. Next week, we would like to schedule possibly 2 meetings. It will be noticed to the public, but we need to schedule these so we can test this to make sure everything is working correctly. Also, we are working with the city attorney's office on a virtual meeting protocol process to incorporate public participation in these meetings, and that will also go out as well to the public and to the commissioners. Right now, everything is a process, and we just ask that you all be patient with us because we're all learning this system, so we just ask that. And I don't know if Bob wants to chime in here as far as it's really up to you all if you want to have this April 20th meeting, so we're going by your lead, so I'll leave it at that.
Well, we are not allowed to take any
No, exactly, sorry. No, but yes.
Okay.
So
yes.
Mayor, just on Ms. Griggs' point, we have scheduled the April 20th meeting.
Yes.
We do have agenda items submitted. We will be doing the agenda follow-up that we regularly do with all of the department heads tomorrow to actually agenda the items. And again, really and truly, it is a work of progress between Ms. Griggs' office and IT to make sure we have a connectivity process. And, I will then, leave it up to Mr. Fournier to provide any further input, or Mr. Rodriguez.
Okay, thank you. So why don't we have Mr. Fournier first and then Mr. Rodriguez. Mr. Fournier, go ahead.
Okay, thank you, Mayor. Here is where I have to talk about the Governor's Executive Order 20-69, and I want to talk about, first of all, what that does, and then second, what it does not do. And first, I'll tell you that it will expire on May 8th unless extended by the governor, which I think that it probably will be, although I have no way to tell for sure. But that is the order that what it does do is it suspends the legal requirement that a quorum of 3 commissioners be physically present to conduct a meeting,
Fournier?
and that meeting be conducted in a public space.
Mr. Fournier?
It also says that,
Mr. Fournier, one second.
Bodies.
Mr. Fournier? So
yes.
we're getting some sort of feedback going on. I don't know if somebody has not muted or if you're using a speakerphone, but if everybody could just pay attention and mute your phones, and then try to say whatever you just said again, so that we can try to hear you this time.
Okay, I heard that too, so I wondered. What I had just said was that this executive order suspends the legal requirement that a quorum of 3 commissioners be physically present to conduct a meeting, and that meeting be conducted within a public space. And it's effective until May 8th unless extended. And this order also specifically says that local government bodies may utilize communications media technology such as telephone and video conferencing, and it references that be done in accordance with a specific statute that's in the Florida Administrative Procedures Act. But what it does not do is it does not waive compliance with any applicable provisions of the Florida Constitution or the Sunshine Law with respect to the general public's ability to attend and observe the meetings and the general public's ability to participate prior to commission voting on anything that qualifies as a proposition under the statute. So there's really been two issues that I want to just discuss very briefly that we've been worked on. As the city auditor and clerk just said, one of the provisions that we have to do is come up with a set of uniform rules of procedure that are published and available to the general public a reasonable time in advance of a virtual meeting. And they're supposed to do such things as tell the public and tell persons who are interested in attending remotely from a private location how they may do so. And they have to contain a provision that says that all of the evidence and argument or testimony presented will be afforded equal consideration regardless of how it's communicated, and should explain how advance notice of the meetings to the public will be provided, et cetera. All of the things that you would think the public would need to know in advance of a meeting like this so they would know how to participate prior to the meeting commencing a reasonable time in advance. And then the second issue is something that I think we're going to talk about one more time. And essentially, obviously, if the commissioners don't have to be physically present, then the public who wants to participate can, and under these circumstances, I think preferably attend from a remote private location. But there is a law to the effect, and it is the way the Sunshine Law is applied, and Attorney General's opinions opine that if that access has to be available not only to those members of the public who possess a computer with internet access, but also to those who do not have access to the internet, and they would be provided access at a public place. And this has been the topic of some conversation between the city auditor and clerk's office and myself, and they came up with, I think, what will be a workable plan to perhaps use 112 and outside access so that anyone who didn't have the private remote access could view the meeting there and participate. However, we have become aware of other municipalities, some neighboring, that are not having the public place access right now in light of the nature of this public health emergency. I think that's understandable. So we want to look at that again. And looking at this closer, I think there's perhaps some arguments that could be made in support of that. And so that's an issue that we're going to have to be worked out. Certainly, we want to encourage and favor public participation, but I think it's also important to be mindful of the safety of our employees under the circumstances as well. So that's the one open issue, and that's pretty much my summary, Mayor. Thank you, unless there are questions.
Madam Mayor.
Mr. Brown.
And just quickly, Mayor and Commissioners, one of the things, since this is the first meeting that we're trying to hold virtually, we have not included public hearing items as part of this agenda, no presentations or proclamations to avoid the public, interacting with us. So obviously things like citizens input, that will still happen, but any major items that will require a public hearing type discussion, we are holding off on those to see how this first meeting goes, and then we will see how we can schedule those in the future. Sorry.
Thank you, Mr. Brown. Why don't we hear from Mr. Rodriguez first about the IT update on this, and then I'll do roll call of commissioners' questions. Mr. Rodriguez.
Yes, thank you. Herminio Rodriguez, for the record. This next phase presents a lot of challenges, and we've really been trying to prepare for some of these with everyone in the clerk's office. The first is this environment. Our platform of choice is going to be Cisco WebEx. This platform we only got right before this issue started, so we're not, us ourselves in IT are not that familiar with this platform. But having a meeting on a total digital platform, really the issue is, you have to be able to control how are people connecting on the devices they have, and we obviously don't have that kind of control for home use. So, the experience would be constricted by the bandwidth at each of the commissioners' home, the devices they use at home. It also depends on bandwidth utilization at worldwide. Everyone is changing over to remote sessions. So our web provider could crash. Things could slow down. There could be pauses. There's a lot of unknowns that we can't really mitigate because of the nature of the application. Cisco WebEx is an enterprise application, so we have a lot of faith in the platform. We do have to test it a little bit more. We have 2 tests coming up, and then in I believe this week without the commissioners, and the following week there'll be 2 additional tests with the commissioners before we open it up for the public. Some of the other things that I see is the public comment part of it. We are going to create something called a WebEx type meeting that the moderator will be able to mute and unmute the public or other participants, so there will be some control to kind of understand and manage that workflow. And that's going to be difficult because everybody will be remote for the most part. So we really have to test and write up and learn from our experiences. And this is an evolving situation. I'm closely working with the local agencies, and as they progress, they're providing feedback. So we're all trying to help each other to make this as seamless as possible. But it is, the expectations need to be correct. It's going to be difficult, but I'm sure we'll get it all going, and everyone will do a good job. It'll be a good experience for everyone.
Thank you, Mr. Rodriguez. We have a question from Commissioner Shaw. Commissioner Shaw, go ahead.
For Mr. Rodriguez, is it possible that we may be in different parts of 1565, the building itself, inside City Hall, to make this a simpler process?
Yes, sir. That would make it a lot simpler because we manage the bandwidth and the internet connection at the city. Actually, at any location at the city, could even be in different city properties, different city buildings. If we had that, that would help us a great deal. And if we could provide laptops, say the same laptop for everyone instead of different devices, that would make this experience a lot better. Yes, absolutely.
I have a question,
Thank
Mr.
you.
Rodriguez.
I just think
have a laptop.
I have a question.
Commissioner Brody, go ahead.
Couple suggestions. One is obviously keep the meeting as short as possible. I think that we should keep the meeting on the schedule to deal with any other issues that might come up between now and then. I think we're clearly going to be having some more significant discussion about COVID and the response and everything we've been talking about today and updates, which is probably going to take the most of it. I also don't have a problem doing it like we're doing it now. For if you need more time to test it, as long as it's a very basic meeting and there's not any items that are going to require a lot of public input or significant public input. I would also suggest setting up, a lot of the essential businesses are setting up lines, doing whatever lines that they have, spacing people out 6 or 8 feet. We could set up a kind of computer station, video conference station outside of City Hall, in front of the building or something. And if people want to come and stay 6 or 8 feet apart, they can kind of, get on the computer like that. But I just think we keep it as simple and minimal as possible so we don't have to deal with this. That's all.
Mr. Rodriguez, you want to respond to that comment, please?
We discussed that with the city attorney's office and the clerk about having a dedicated space, a dedicated computer connected to the WebEx session that the public can come in. I'm not sure where that conversation is at, but we can certainly do that. We can certainly make a machine. We have we have full connectivity around City Hall. So if we want to put something outside, if that's what the direction, we can certainly accommodate that.
Like under, maybe over by the city manager's office where it's covered. I just think I'd rather keep it outside, keep it open air if possible. I don't anticipate us having any kind of, maybe one or two public comments for a basic meeting like this, but, just my suggestions. Open for whatever you guys put together, though.
Okay, thank you. Mr. Brown, do you have a comment?
Yeah, just Commissioner Brody, Mayor and Commissioners, we did talk about, or we did speak amongst ourselves about having an outside location. Obviously, Commissioner Brody, I think you alluded to the weather. And, how do we ensure the managing of the social distancing, the use of the computer if someone is typing in, information, and obviously keeping the computer sterile. And so those are one of the things that we're talking about in terms of maybe having a sort of an inside location that someone can submit their question and have a staff person type it in and transmit it to the mayor to be read. So we are looking at all those things, Commissioner Brody, and obviously by either later this week or next week we'll have a solution to that issue.
And that, Shayla Griggs, City Auditor and Clerk, that is a part of our virtual process protocol that we put in there, a specific location to try to be able to have the public come in if need be.
Okay, thank you. I do hear some background noise, so if somebody could be just a reminder to mute. Commissioners, I'm going to do a roll call to see if you have any questions up to this point. Commissioner Alpert?
No.
Commissioner Alpert, maybe you just want to comment on your thoughts on going forward with an April 20th meeting?
Well, I think, technologically we should be able to work it out. I don't see why we can't. A lot of governments are doing virtual meetings. There are different platforms that can be used, and I feel like Mr. Rodriguez is knowledgeable about all those things, so I'm sure he'll find a way for us to do it.
Thank you. Commissioner Brody, do you have any added comments or questions?
No, just what do you all anticipate us even discussing? The way I envision us just talking about what we're talking about now, unless there is some commission action needed on COVID. I think we should really just keep it super basic. Other than that, I don't even think it's necessary, but because we have to deal with this and we want to have some communication during this crisis, I think it's important. I just think we should all remember that April 20th is going to be a different, I think it's going to be a different world than we're living in today on April 6th.
Okay, thank you.
Well, Mayor, Tom Barwin here.
Just one second, Mr. Barwin. Mr. Fournier has a comment. Mr. Fournier?
Yes, thank you, Mayor. To Commissioner Brody's comment a minute ago, if it was necessary to have the meeting on the 20th telephonically, I just wanted to say, having looked around the state at some other jurisdictions and how this is being done, I am aware of some jurisdictions that do require public comment to be all submitted in advance for items that are not public hearings, of course. So if the agenda on the 20th were no public hearings, which I don't think there are any scheduled, and if it had to be done because of challenges that IT faces telephonically, one option is to have all the comments submitted in advance prior to the meeting. So I just wanted to comment on that. That's all. Thank you.
Thank you. Mr. Barwin, go ahead.
Yes, Mayor. Thank you. Tom Barwin here. Just most of the items that are going to be discussed in the agenda plan review tomorrow are able to be on consent 1 and consent 2. Mostly housekeeping things that we're more or less required to do, whether not more or less, that we're required to do by law in terms of our continuing services operations for programs we're continuing to function and complete. Maintenance, public works things, cleaning,
things like that, some budget transfers. There are no public hearings planned. We present, technically we're required to do this, present the CAFR, that's our audit. That doesn't have to be a long presentation. That can be summarized by one of our staff or an auditor in probably 5 minutes, and that's just housekeeping. We can put it behind us. We'll look at a program. There's only really, as far as I can tell, one item that we have at night under new business, and we could maybe push that to the day considering the circumstances, and that's seeking your approval on a customer assistance program for low-income households in our water and sewer utility operations. Other than that, it's mostly housekeeping, and certainly we can leave or talk about COVID updates, at the outset or at the end of the meeting.
Okay, thank you.
So that's what we're looking at, unless Marlon Brown has anything he wants to add.
Not at this time, Mr. Bowen.
Okay.
Commissioner
Brody, go ahead.
I don't think we should have any new business items that are complicated or new programs. There's just not going to be any kind of proper vetting going on. We need to really keep that at a minimum. The public is not going to really have a great chance to be a part of that. I'd rather our meetings be what is absolutely necessary to deal with this crisis and anything else needed by law. But other than that, I don't want to have a bunch of, complicated issues on there.
And Commissioner Brody, there aren't any items that are complicated, as Mr. Bowen alluded to. All the items are items that are necessary. And again, we as management, Mr. Bowen, myself, Ms. Griggs, Mr. Fournier, we have looked at the agenda. We've tried to keep it as skeletal as possible, knowing that, number one, this is a virtual meeting. We didn't want to keep it, we didn't want to make it complicated or complex. And so it is as simple and it's as boilerplate as you can imagine an agenda could look. So,
what's the new business item?
The new business item is a Office of Housing and Community Development item that we have to have you review as part of the federal requirements. It was not delayed, or there was not any executive orders that delayed it, so we have to get this item before you. I can share more about the item when we do the one-on-ones prior to the April 20th meeting.
Okay, thank you, and make sure you all mute your phones, please. Commissioner Shaw, do you have any other questions or comments?
Only comment, I think this is most exciting. What a beautiful experience. Love it.
Thank you. Vice Mayor Freelandetti, comments or questions?
No, I would just say only set it if it requires that we take action. If not, keep it as a workshop, keep it in the afternoon, and let's, not meet unless we have to, because this does just present a different format. But I think technology-wise, I'm satisfied that the IT department can get it done.
Okay, thank you. And I have no other comments other than that. I'm okay with the suggestions that if IT can't be prepared for this meeting, the next meeting, that this sort of a format works. Although I don't know, legally how that will work out, but Mr. Fournier, I'm sure, can work that out. And then also, I'm also amenable to Commissioner Shaw's suggestion of if we have to meet as commissioners, or even one or two of us here at City Hall, obviously we can do this again, and maybe one or two commissioners, if it's easier to be in their office, we could do that. One upstairs. I don't know how ever, but I'm also amenable to that suggestion. So at this point, I'm just going to do a roll call of any additional comments or questions, and then we can adjourn. Commissioner Alpert, any additional comments or questions?
No, I'm good. Thank you.
Thank you. Commissioner Brody?
Just that, to the public and to us all, to just keep the social distancing measures in place. They're going to become more and more important. And, that I think is going to be tough for some people, because a lot of people that have been following them have already been cooped up in their house a long time. And as more people come forward that have the virus, the easier it is going to be to catch in the coming weeks. And so I just want the community to kind of mentally prepare themselves for that, because it is going to become, much more susceptible to contracting it as we move forward and towards the peak, May 3rd. That's all.
Thank you. Thank you. Commissioner Shaw, any additional comments or questions?
Yes, to the very point that the commissioner had alluded to, if we're not getting the testing throughout the community, how will we know what's positive and what isn't? How will we know where these numbers are? I just think that that is the bigger part of this, and the protocols that you get with the mayor before you speak. Thank you.
Thank you. Vice Mayor?
Can I comment on that?
Commissioner Brody, go ahead.
In my opinion, obviously not expert, but right now the testing is so poorly accessible that it is not a great number. And that's why I've asked the city manager and SMH to really make their numbers in their hospital beds. The number of hospital beds being taken is probably the best indicator that we have right now, because those numbers don't lie. The testing, is so unreliable because it's just not accessible as it used to be.
Thank you. Thank you. Vice Mayor, any additional comments or questions?
No, I'm satisfied.
Thank you. Charter officials, Mr. Barwin, any additional comments or questions?
Just two things. I want to echo the compliments to the public. The vast majority of this community have been really, really cooperating, and it's been impressive. Our towns and neighborhoods most of the day are just, there's not much happening. But just some inside information, I hail from Michigan and Detroit, the arsenal of democracy in World War II, and I hear from my inside people in the Motor City, they are ramped up to start producing medical equipment, including face masks, protective medical face masks, where one of my relatives works at the Ford Motor Company. So I am increasingly optimistic the pipeline to supplies is going to begin opening, and let's keep our fingers crossed that happens soon as the private sector really gets fired up. That's all I have. Thank you, Mayor.
Thank you. Ms. Griggs?
No, Madam Mayor, not at this time. Thank you.
Thank you. Mr. Fournier?
Other than to say I was glad to hear the city manager's last comment, nothing further. No, Mayor.
Thank you. Mr. Brown?
Just, Mayor and Commissioners, just a huge shout out to our staff in terms of the work that they've done. I've been very resistant to some of the millennial requests about working remotely from home. And I must say that the level of productivity and the level of commitment to the job it is very astonishing. And those who are on the front lines, from public safety to the public works employees, utilities, those who are in the office buildings continuing to provide that service to the public. I'm just, very much grateful to their commitment to the job and their commitment to the city in terms of ensuring that level of service and the quality of service continues above and beyond. So again, thank you to the staff, and thank you to the commissioners for supporting the staff in terms of this crisis that we're going through and the work that they're doing from home.
Thank you. Thank you. And just my last comments would be, I want to thank all of the healthcare workers and the essential professionals that are on the front lines helping us get through this crisis. And of course, my thanks to the city management, the city staff, and to everybody here. I also want to thank my fellow commissioners. We have not had any lines of communication really. And it's very lonely sitting up here at this desk without you here, and I look forward to the day when we can all return here and get back to our regular commission meetings in our relatively cramped space. And while I do enjoy the extended space, I don't enjoy it so much so that I would like this to continue for much longer. But everybody is missed, and I want to wish everybody to please stay safe, follow all the guidelines and the protocols, and share good stories. When you hear stories of kindness and compassion, please share those on social media or any other way you can, because those are just as important as the data and statistics that we're reading to keep us ahead of this crisis. So thank you all, and the meeting is adjourned.
Thank you, Madam Mayor.